Hi, I'm Judith Grant. I'm a nurse practitioner, and I'd like to thank you for taking the time to join me. This presentation is about long COVID. Long COVID is something that not only has been documented to exist, but many people in our country are suffering the consequences of it. There are a lot of folks out there that think that they are just sick and tired of being sick and tired. And there's a reason for that, a very real reason. So in a few moments, I'm going to share my screen with you and give you a little bit of an overview of long COVID, what it is, how to know whether or not you have it, and what you can do about it. So as I share my screen, thank you. And here we go. So long COVID is also called post-acute COVID. And like I said, this is something that is being documented and written in many of the nursing and medical journals at this time. Anytime you have long-term effects that have persisted since the time of having an initial COVID-19 or SARS infection can be looked at for a long COVID condition. This post-COVID or long COVID haul can last anywhere from months to absolutely years post-infection, after the original infection. The statistics right now, though they're not all in, are that about 5 to 30% of those infected with COVID-19 may suffer from long COVID, but these studies are varying between population and also the severity of the infection and the particular variant that you had. So here's some of the symptoms that we see commonly in the complaints, and that is unusual fatigue that has no other explanation, shortness of breath, or chronic respiratory infections, brain fog where you just don't feel like you can retrieve information like you once did, headaches, minor memory losses, a general feeling of apathy or a loss of motivation, and most of that is secondary to the brain fog and the fatigue. Post-exertional malaise, that's where after you've done something like work out at the gym or done any kind of physical work that you find yourself absolutely wiped out. New onsets of things like IBS or GI issues or worsening ones, loss of change and change or complete loss of taste and smell. Now, although that's common during the COVID period, many people are reporting that long after, things still don't taste the same or smell the same, and it seems to be intermittent. A lot of people don't have it all the time. It just pops up in and out in their life. Increased symptoms of autoimmune disorders. So anybody with autoimmune disorders see like an increase of their symptoms or a worsening of their condition. But again, there's a wide range of symptoms, and it's not uniform, and you don't have to have all of them. And they can last anywhere from 3 months to possibly being chronic, which means it could be without end, or what we see right now is without end, just ongoing. So what are some of the causes that they're looking at right now? And again, evidence is still being collected in data, but just the viral persistence or the dormancy of the virus. This is a virus that can literally just lay dormant in your system as though it's gone, and then under the right conditions, maybe another exposure to another infection or a lot of stress or not such great diet or exercise routines and such, and it can pop up again. Immune system dysregulation of any kind, organ damage, if you had damage to the organs during the initial COVID, or if you suffer with organ damage from other causes like cirrhosis of the liver, etc., you might have more of this post or long COVID. They're looking at autoimmune response and histamine response. When the virus first comes into your body, the body sees it as foreign and literally mounts a histamine release. And there's like a cytokine storm that goes on with the immune system, and the battle begins. So there is a link to long COVID and a histamine response, and also the change or decrease in the health of the microbiome system. Now, the microbiomes are your immune resources, and very often we see after viruses like this that there is a deficit or a decreasing quality of its performance. So the body is literally under attack. So risk factors, again, vary. The initial infection and its severity is going to play into how much you're going to have a long COVID response or whether or not you will. Very severe, obviously, episodes of COVID can then lead you at more of a risk for severity. But I really want to just make note that there are people that have had COVID that didn't know they had COVID, that their symptoms were mild, but they had it a number of times without knowing. So actually that infection laid kind of a low level but dormant through a long period of time. How many times you're exposed absolutely does play an effect in it. And the demographics, things like the older that you are, increased age. It seems to be showing as being more prevalent with people that are female rather than male in gender. Pre-existing conditions like diabetes, heart disease, respiratory diseases like asthma, COPD, and other autoimmune disorders, poor nutrition and diet, lack of exercise and stress, all these things. So in other words, anything that's going to bring down your immune system can also leave you open to a possibility of long COVID. Vaccination statuses. I did a lot of research back and forth, and I get kind of mixed messages about it. So I'm just going to say at this time, it's unclear if there's a higher or lower risk for being vaccinated or unvaccinated, because there are cases of long COVID amongst vaccinated people also. So again, I think we're just beginning to understand all of this. So diagnosis, there's no specific diagnostic test, like you can't get a test that says, yes, this is the blood test that shows you have long COVID. But we base it on clinical evaluation and the history of the infection that you had. We do symptom tracking. We want to know and document how many symptoms you've had and what kind of symptoms over a period of time. When did you have the COVID? When did you first start seeing a change in your body and your health and your well-being? And what kind of changes did you notice? Were they physical and or cognitive? All these things are important data. And also any treatments that you may have gotten or any specialists that you may have seen since that time to look further into this, ruling out other diseases. Management and treatment is based on symptoms. Again, after we've ruled out any kind of other major problem and we're looking at long COVID, you tailor the treatment, like pulmonary rehab if there's respiratory problems, or fatigue management. Very often diet and nutrition, nutritional guidance. Multidisciplinary care is the best way to go, looking at a variety of specialists depending on, again, the complaints and what you've noticed in your life. But a holistic approach to manage long COVID seems to be one way of going, and a very important way, because it looks at treating the whole person rather than just the symptoms. We integrate the physical, the psychological, and the social aspects of health and look at all those areas. Nutritional therapies like anti-inflammatory diets have shown to be effective, emphasizing foods that reduce inflammation, like your omega-rich foods and such, and your salmons and lots of fruits and vegetables. A lot of people will add supplements, and again, there's some pretty good research on building the immune system using vitamin D, vitamin C, the methyl B complex, omegas, probiotics for the gut health and that microbiome system, zinc. And again, we want to focus mainly on how do we build the immune system? How do we get the body at its healthiest self while recovery? And then there's breath work and environmental adjustments. For people who have ongoing respiratory issues, techniques can be taught to improve that lung function. There's a lot of different breath work that you can do, managing symptoms like shortness of breath and pulmonary rehabilitation programs. All these things are available. And then making environmental adjustments to help your body in recovery, ensuring there's a healthy home environment, minimizing exposure, obviously, to pollutants and allergens that you might have, getting rid of other triggers that might worsen symptoms, getting chemicals out of the home, because we know that when you breathe in chemicals, that you literally, they're respiratory irritants, but they're also neurotoxins, and that's just hitting your body with external stress that your immune system has to fight off every day. So you want to eliminate as much as that as possible to give your body a fighting chance. Physical activity. You want to pace yourself, especially if you have exertional exhaustion or post-exertion exhaustion. We want to look at carefully balancing rest and activity to avoid that, because we see that a lot in COVID, long COVID. We don't say stop exercising, obviously not. You want to do that, but you have to listen to your body and pace yourself. Yoga, Tai Chi, light walking, all those things can be tailored to an individual's need and their physical ability. You want to maintain muscle strength and flexibility without exacerbating symptoms. And then there's the mental health. When you're dealing with never feeling well and feeling like your body is unrecognizable to you, your health is not the same, your thinking is not the same, and it can create a lot of stress, a lot of mental stress. So cognitive behavioral therapy, hypnotherapy to manage the stress and anxiety or depression can be very significant in long COVID, and these are things that can help with that. I'm a firm believer of mindfulness and meditation. These practices do help with stress management, with mental clarity, but also help with respiratory function. And then there's alternative therapies that span a very wide scope, everything from acupuncture to medical massage to trigger point injections for pain and stress relief, red light therapy. There are some studies that are showing that it is very, very good with stress management, but also to reduce inflammatory processes in the body. Tesla TENS therapy is a type of TENS therapy that is dual wave that also helps with pain management, decreasing inflammation, increased circulation, restoring cellular integrity, and improving sleep. And then there's herbal medication. And I always say caution with this. It should only be under the guidance of a qualified practitioner that knows herbology and knows how herbs may interact with other medications or each other. Herbs can be a very good thing to do, but you still have to know what you're taking, how you're taking, and what its interaction may be. And we just have to be responsible with those things. And then there's energy healing, which can improve circulation, reduce pain and stress response. Energy work like Anra, or therapeutic touch, hands-on therapy, is also known to help with improved circulation and stress improvement, or the decrease of stress. And then sleep management. the body needs to sleep. And when we go into REM at night, it really helps our body reset and our brain reset and restore neurotransmitters. So getting into healthy sleep habits to help your body, creating a routine of sleep, and making your environment conducive to good sleep. Reducing blue light exposure and screen time before bed is essential. There are natural sleep aids like melatonin, magnesium, valerian root. But again, always suggest or discuss these things with your healthcare provider or somebody who is very, very informed on their use and how to use them and use them correctly. And then community support. Support groups are popping up, and I know we're going to be doing community support at our center. Connecting with others that are experiencing long COVID can provide that emotional support, but also practical advice like what's worked for other people and ideas, kind of brainstorming and knowing that you're not alone and that you're not crazy. Educational workshops, just like this one, where you can learn a little bit more about the symptoms, and there are plenty of community and online resources. Connecting to a long COVID center can also be effective. I know that at Pathways, we are creating at the Pathways Center a long COVID center to help people. So integrative medical approaches, absolutely. You want to always have a balance. That's what I believe in, mind, body, and soul. And also integrating the best of conventional medicine with complementary therapies. It's not an either or. You want to look at all aspects from diet to mental health and find the right formula for you and for what you're experiencing. It's not a cookie cutter. So all these approaches should be customized. There should be a good medical history, a current health status known. Again, we want to know what you've tried, what has been ruled out as possible other causes of these problems. Individuals need to work with their healthcare providers and acknowledge the complexity of this and honor what they're going through, and also that would be open to other holistic methods. But again, always consult the healthcare provider before starting a new treatment or a new therapy, so that you don't have any interactions that would act adversely with you. Very important. But if you want to know more, or if you want to have an appointment with one of our nurse practitioners about a long COVID evaluation, treatment, or referrals, again, my medical practice is JJGNP in Adult Health, and we're located at the Pathways to Health Center at 464 Route 25A in Miller Place. And our phone number is 631-642-2200, option 1. Again, we'll be available to answer your questions and to help you if you feel that you may be experiencing the long COVID scenario as sequela, and find ways that we can help you to the best of our ability. So thank you very much for your time, and have a very blessed day.